I'm Stephanie Robert. I'm a professor in the School of Social Work, and I've been here for 15 years. Before that, I was a postdoctoral fellow at the University of California, Berkeley. When I was looking for jobs in schools of social work, I was very interested in two things. One, finding a place that was serious about research and teaching, and another that had good family balance. And I have found both at Wisconsin, which is why I've stayed for 15 years. We're one of the premier schools of social work that attends to research in the country, and I found that the supportive environment from my colleagues has meant that it's been easy to raise my two girls during my time here as a faculty member. One of the things I love about the University of Wisconsin-Madison is its low walls. And by low walls, I mean we don't only work within the School of Social Work, and people in other departments don't only work in their department. We get to collaborate with each other across the board. And as a health researcher, it's really important for me and for my students and postdocs to be able to collaborate with people from all over the campus. My research is really focused on understanding the many social and economic factors that affect people's physical health and well-being. So in particular, much of my research has focused on looking at how neighborhood context affects the health and well-being of individuals. Why it is that people living in a high poverty neighborhood, for example, have worse health than people who don't, or living in a racially segregated neighborhood, why that's not necessarily good for your health. My work starts with the premise that social policy is health policy. So in our country, we act as if we equalized access to health care today, we would all have better health. While it's very important to have equal access to health care, and I'm fully supportive of that, what we've learned is that social policy has a lot more to do with health than health care policy. So if we improve poverty, if we improve people's quality education and access to education, that will go a lot further towards improving people's health and reducing racial and socioeconomic disparities than if we only focus on equalizing access to care. Students who are thinking about going into social work need to know that this is one of the most honorable professions there is. After going through social work training, you have the opportunity to get paid to do what I think everybody in society has some responsibility to do.